Yeah, not a clickbait. My patient died in my arms today. Yeah. Hi everybody! Today I have a new story for you, and hopefully you get depressed after this video. Now, as a paramedic, I've seen a lot of deaths. I've responded to many cases where the patient was already dead. I've seen so many patients, not so many, but many patients that were alive and then died with me. It's just their time, and I happened to be there at that time. But this one was different. This one, the patient was okay. He was breathing. He was talking to me. He had no complaints, almost no complaints, and he just died. I'll just get into the story. So the call was trauma. It was a case of fall. So we arrived on scene. The daughter came out calmly. Her car was even parked in front of her house, so she like parked somewhere else so we can park right in front of her house. Everyone was calm. Usually in the family are calm, then it's not a critical situation. Usually, not always, but usually. So we got our equipment. We went towards the patient. We saw a guy that fell right in front of his house. He's about 45 years old. Eyes open, awake, breathing normally, everything's fine. He's not even like in pain. It was like just like chilling on his side. So we arrived on scene. Hey sir, how are you? I'm good. How is everything? I'm good. Do you have any pain anywhere? No. How did you fall? He was just standing and he slipped and he fell. That's it. Okay, so did you lose consciousness after you fell? No. Did you lose consciousness before you fell? No. Do you have any pain anywhere? No. Can I do an examination? Okay. Do you have any pain in your head, neck, back, chest, pelvis, anywhere? Just a little bit of pain over here. That's it. But now while I'm checking the pelvis, the patient peed himself. Why did you, sir, what is this? The patient was like, yeah, I don't know, after I fell, it just went out. So do you have any problems urinating before? No. So now I'm thinking seizures, right? Because seizure is one of the symptoms of seizures. Patients have incontinence of bladder. So I was like, I looked into it more. Do you have any tongue bite? Did you lose any consciousness? Are you sure nothing happened? No, he was standing. He fell. He was totally conscious. He fell on his abdomen, and his abdomen hurts a little bit. And he peed. So maybe from the pressure of the fall, I was like, I didn't really know why, but I was like, okay, nothing really alarming here. Okay, so I asked about his history, I asked about his medications, I asked about everything. He only had hypertension. That's the only past medical history he had. Plus he had COVID 2 months ago. That's it. That's all he had. So I was like, okay, sir, I think everything is fine. Can you just sit up? I just want to see if he can like walk normally and, you know, function normally. And he wanted to sit up, but while trying to sit up, he's like, no, my abdomen hurts, and he just went back. So I was like, okay. I told my partner, can I just bring the stretcher, please? So I took the patient's upper body. I was holding from the back. My patient was holding from the legs, and we just wanted to slide him onto the stretcher. I looked at my partner. I was like, okay, ready, 1, 2, 3, up, down on the stretcher. I looked at the patient. I tried waking him up, I tried shouting his name, and I tried like, you know, shaking him, no response. So when there's no response to the patient, what do? You open the airway and you check for breathing. That's exactly what I did. I opened the airway just like this. I tilted his head. I checked his breathing for around 10 seconds, no breathing. I looked at my partner and I was like, the patient just died. I didn't really say that, but I was like cardiac arrest. Hopped on his chest and I started chest compressions right away, and that's what he should do if someone's not breathing, and just jump on his chest and do chest compressions, and that's exactly what I did. My partner came, he put the pads on, he checked the rhythm. The rhythm was not shockable, it was PEA, pulseless electrical activity. That just means that there is electricity in the heart, but the heart is not mechanically pumping, there's no pulse, but there's electricity of the heart, so it's not shockable. He took over the chest compressions, I managed the airway, and while I'm managing the airway, and then the daughter came and she started screaming and crying, and I was worried that she would pass out as well, so now we might have 2 patients, but thankfully she didn't. And I tried talking to her at the same time while managing, you know, the airway and putting an LT and managing the breathing. It was tough. It was a hard case. And then from the crying, the rest of the family came out. There were so many family members, and they were all like crying. They were all polite. None of them like tried to interfere with our management, but the scene was bad. It was bad. We kept doing chest compressions. There wasn't any shockable rhythm. We kept pumping medications into the patient's body, hoping that his heart might come back to life, but nothing happened for 50 minutes until we reached that hospital. And then, yeah, after we reached the hospital, the doctors took over the patient, and they kept doing cardiac arrest for around 15 minutes, and then they called it off. They announced that the patient died. Yeah, this was, I don't want to say the weirdest case, but it was one of the weirdest cases I've ever had. He was totally normal, breathing normally, talking to me, and he just like that, in 1 second, he just died. Now, going back and thinking of why would the patient die, I only had two theories in mind. A tear in the aorta. There's the main artery that, you know, delivers oxygen and blood to your entire system. You know, if anything happens to that artery, you just die right away. You die right away, like in seconds. In 5 seconds, you just die. The patient had hypertension, which is one of the risk factors, plus the fall on the abdomen. That was not the case. I kept asking the doctors, and they did an ultrasound on that, and yeah, his aorta was fine. Now, the only thing that I have in mind that could be the case, I don't know yet what's the cause of death, but I think it was an embolism. Could be a pulmonary embolism. What caused that? It could be because of his history of COVID. Yeah, COVID causes clots, and it could be that a clot formed somehow, and from the movement that we did to the patient, a clot moved into his lungs probably and died. That's just a theory. I don't know any other possible explanation. I don't know, maybe there is, obviously, I don't know. So yeah, that was a weird case. And then you go back home and you try to live your life normally when someone died in your arms, like literally died. So yeah, this is our job. You see a lot of people die in front of you, which sucks, but at the same time, there's this one case where you save someone's life, and then you feel happy and you feel like it's worth it. If you're watching this, pray for him, please. Pray for his family. Allah yarhamah. That's all I have for now. See you when I'm gonna see you. Goodbye.